access to a recording. All right. Hello, everybody. I am Dr. Zeller. I don't want to ignore everybody. Let's see here. So I'm Dr. Zeller. I will be your instructor for this class. Welcome to OB. You've probably heard horror stories about this class, and I'm hoping to dispel those myths, and I'm here to support you in your learning, okay? There are plenty of resources to help you through this particular class, and we'll go over those today. Let me tell you a little bit about me. I was born and raised until I was a little older in Ohio. I graduated from Ohio State in 1985. So I've had a lot of years of nursing. And I worked for a while in the med surg area briefly and went to critical care, OB, and then surgical training. And then moved to Florida and practiced for a while. And then to Tennessee and spent quite a few years there. That's where I got my doctorate at Vanderbilt in nursing practice as a women's health nurse practitioner. So I've seen just about anything. Okay, so I look forward to teaching you and helping you grasp things. So before I forget, well, wait a minute. I'm now in Michigan. It's much cooler up here. I love the cooler weather, and I only teach online. I'm not on any campus now. When I started with Fortis, I was in Nashville and taught on their campus. And then when COVID broke out, I moved to just the online faculty when we had to start up that program for several of our courses at Fortis. So I've been there since. I've been at Fortis online since 2020. So I can basically live anywhere since I don't have to go to a campus on a regular basis. So I love to teach. I did teaching when I was a registered nurse. When I was working, I had nurse interns with me. When I got my master's, I was practicing as a nurse practitioner, and I was working on my doctorate as well as precepting other master level students. And then I started teaching part-time and just loved it. And it gave me a lot of flexibility in my life. So I went full-time to help with the situation in COVID. And I just stuck with it. Sometimes I really miss seeing students face-to-face because it does enhance the relationships and it builds camaraderie among students and having that connection. But this is very efficient. This way of teaching is very efficient and it can work very well for you. So don't think of it as a negative, okay? Some students will tell me, no, they learn better on campus. And that might be true too, but I hope you learn the benefits of online too, especially when you can be at home, right? In a very much more relaxed environment, okay? So what we're going to do today is go through like an orientation. It's going to take a little over an hour to go through these PowerPoint slides. And it's just administrative type stuff that you need to know. You have access to this PowerPoint. So you can refer to it, and it is there are policies, right? So you're responsible to know everything in this packet, in this PowerPoint. And I pull out of it throughout the term to remind you about homework assignments, get them done, and things like that, late assignments, all of that. So it's kind of built from the syllabus, built from Canvas, just to give you some guidelines, okay? So we're going to do that, and you'll have time to ask questions. Anytime you have a question, you can interrupt. Just interrupt me if I'm talking and ask me a question, and I'll try to answer it and clarify things for you. When we're finished the orientation, we will just go over some concepts from your first reading assignment, which is chapters 1 through 3 in your textbook. All right. So when you come to class every week, it's expected that you're prepared, that you've read what you're supposed to read for the week. Okay. In other words, you've already read chapters 1 through 3 and you've looked at the resources so that when you come to class, you know how to ask questions and you know what you don't understand, and you can really engage in class or participate by asking questions. Now, realistically, I know that many students can't get through all the reading. Your goal is to do that. What I have provided, and I will show you later, is I have read the book a couple times, and I made some notes from what I read that I felt like were really important points for you to understand. And that's what you will find in the announcement. So we're going to go through the announcement and I'm going to show you these things, okay? So, and we're going to talk about when homework's due, when the exams are, all those administrative stuff, okay? So when you come to class every week, you need to be here by 2 o'clock Eastern time, 1 o'clock Pensacola time, okay? By, on camera, okay? You cannot miss any class. If you're 5 minutes late, that means you're really 15 minutes late, because I deduct your absence from in 15-minute increments, okay? So if you leave at 4:30 instead of waiting till after 4:30 or 4:41, which is when our class ends, you're going to be deducted 15 minutes. Okay. So if you have something that occurs regularly every week that's going to prevent you from being here on time, or you would need to leave early, it's not going to work. You're going to miss too much of class. Okay. If you have something scheduled this term, like a wedding to go to, or you've already had a flight somewhere, you need to communicate that with me now. Okay. You can send me an email and let me know you've got something planned, and you're not going to be able to be excused from class. There are no makeups, but we need to figure out if it's going to affect your attendance in total. Okay. So I just really encourage you to communicate with me about problems with attendance. If you're going to be late, just send me a text to let me know that you're going to be late. That way I know you're late, and I expect you to be late, and that sort of thing. Okay, so just let me know those things. If you have a sick child or you are sick and you just can't sit up for class in front of a camera, then you don't need to be coming to class. There's no excuse. I mean, you're still get dinged for your attendance. So if you have a sick child and you have to take them to a doctor or a nurse practitioner or somewhere, then you need to provide me some kind of documentation that you went to that place. I don't want personal information. I just want, you can have them write you a work excuse or a school excuse. That's all I need. That way, if you miss a quiz because you had to take your child in, but you provided me with documentation, at the end of the term, if your grade is such that taking that miss quiz would help you pass the class, then we probably would let you take the miss quiz. Okay. That's a long explanation, and I will remind you later. Okay. Any questions so far about anything? Meredith, are you still having trouble with your camera? And okay. Well, we'll work on that later. Okay. So what you can see on the screen here is orientation. Welcome to the new year, by the way. I hope you have a really good year. hope you had a refreshing break. I know I did. And you're one step closer to finishing the program and having a wonderful career as a registered nurse. So let's talk. You can think about online learning, what it means to you. So you have resources on Canvas, and links to resources from Canvas and from everything we give you. We really encourage you not to go outside of Canvas for information, because your tests, your quizzes, and your HESIs are built on your textbook. Okay, so if you get information outside of the textbook or outside of resources we give you, then you're wasting your time, because you might not have to know that. Okay, so online learning requires diligence and organization and planning to be successful. Okay, we have many of us that teach OB. And there's even one missing here. We have a new instructor this term. Her name is Professor Pat Klein. I don't really know much about her yet. She's part-time, but she is available as well. So Professor Danielle McBride is our lead instructor. I used to be the lead instructor, but gave that responsibility up. Professor Danielle McBride is full-time. Professor Robert or Dr. Roberts is full-time, and I am full-time instructor. The rest of our instructors are part-time, so they have other jobs, but they carry 1 or 2 classes every term. Darlene Brown is our online dean. You have a dean of your campus, right? Well, the online classes have a dean, and her name is Dr. Brown. And here's her information. So if you're in a situation where you really need to get hold of her, and we'll talk about that in a little bit, this is her student phone number and her email that you have. So if you have questions outside of class that or something you're having trouble with, or you're not happy about a grade, or you want to know more about an assignment, you contact me first, because I'm your instructor. If it has to do with something about simulation or clinicals or something on campus, you need to contact those people. I don't communicate much with your clinical coordinator or your clinical instructor or your simulation instructor unless she contacts me. I wish it were true, but it's really hard to get our schedules together because we have like 14 campuses, and to get everybody to meet is really tricky. So contact me first or contact your campus. If you are not satisfied with something I said or something I did or how I graded it, and you've already talked to me and you're still not satisfied, that's when you can contact either Professor McBride or Dr. Brown. Okay, don't run to her first. Can you imagine? She's got 2,000 students under her. Can you imagine if all 2,000 students went to her about a question that the instructor could have dealt with? So if you have a complaint about me, please let me know. I want to correct it or fix something or understand what you're dealing with. Okay, so if you get mad at me, and students do, please come to me with your anger. Don't take it someplace else. That's the most professional thing you can do, so we can work it out. Okay. If I offend you, and I have offended students in the past, not intending to offend them, but I have, and I've had to apologize. So I have to swallow my pride sometimes and apologize. So, all right. So, manners. My son used to tell me, he would sit at the table and have not really good table manners. I'm correcting, and he would say to me, "Mom, I have no manners. Because I would say, Michael, where's your manners? He says, I have no manners. But we need to have manners during class, don't we? We need to respect one another, listen to one another, engage, ask questions. If you disagree with someone, please share why you disagree. Okay, it's a healthy conversation, a healthy debate. Okay, but please be considerate of others' feelings. Charmaine, you all don't know. I don't think any of you know. I don't know if you know her or not. I should be careful. Really don't know about her living situation or her home life. So be careful that you don't start complaining about Charmaine, because you don't know what she's going through during her education. Like Natalie, you don't know each other that well, so be very sensitive and careful, like you would a patient. Be respectful. We try to avoid jargon in this class. Use the medical term during your conversation. If you don't know it, then describe it instead of saying. So, for example, if you're interviewing a patient that maybe you're admitting or that's being admitted to the hospital, and you're interviewing them, and you ask them, are you married? How many children you have? And on. And then you ask them, do you drink? Well, good heavens, I hope they drink. They need to be drinking. Don't ask a patient if they drink. You ask them, do you drink alcohol? Or actually, the best way to ask that question is, how many drinks a week do you have? How many alcoholic beverages do you have a week? Because then they're going to give you a number instead of saying, no, I don't drink alcohol. Okay. So just be careful with the jargon. Or another jargon that we use is, she's clean now. Okay. So clean in jargon and the colloquial conversation means that she's not using drugs anymore, but we want to use other words. We don't want to use clean. Okay. So that's just a few things that I think are funny. So Zoom classes are mandatory, and Meredith is on camera. Yay. And Keanu is back with us. So great. We can get started, a little more specific stuff. So we do start by 2:00. Be here with cameras on. They're mandatory. Don't be late. Don't leave early. If it's very necessary that you do, keep in mind, you don't want to miss 20% of the total class time. In other words, from day one to the last day of class. So 20% absence reduces your grade. So you do not want to miss class. So homework assignments we'll talk about. I've tried to put my Zoom link as many places as I can think of it. It never changes. If I meet with you for tutoring, or you want to go over what concepts you missed on a quiz or the exam, it's going to always be the same Zoom link. If I have an exam review in week 3 on Sunday night, I have exam reviews. Same Zoom link. Sunday evening, when I have a regular weekly review, Zoom link, same thing. Okay, it never changes. All right. So, but somebody will ask me what it is, and that's okay. So we have a Norfolk student in here. We have Pensacola students in here. And who else is in here? What other campuses did I miss? Cutler Bay? Cutler Bay. Okay. So everybody is in Eastern time except the Pensacola students, and they're in Central time zone. So keep that in mind, because your class will start at 1:00 and not 2:00. And homework assignments. Okay. The structure of Canvas is built on Pacific time. I don't know why. We have no campuses in Pacific time, but it's built that way. So your homework assignments are due everybody, Pacific time at 11:59 p.m. on Sunday. But since you don't live in Pacific time and no one in this class lives in Salt Lake City, Pensacola, your homework is due Monday morning at 1:59 a.m. Okay? Because that's the same time as 11:59 Pacific time. The rest of you who are in Eastern time, that the time for you would be 2:59 a.m. We're all on the same time, but because we live in different zones, your homework is going to be due. So if you work until 11 o'clock at night and you haven't done your homework for the week and it's Sunday night, you still have a couple hours, right, to do your homework. Get it done before it's due. Okay. All right. And this is just a picture of the different time zones if you're not familiar with them. This is in the US, obviously. Academic integrity, just doing your own work, not doing your homework with somebody else, not using someone else's homework, not giving your homework to someone else. So let's say Gabriella needs help on homework and she asks Stormy if she could have her homework or help me with my homework. No. Stormy would be just as guilty if she gave Gabriella help as it would be for Gabriella to use Stormy's work. Okay, so we don't share homework burdens. Okay. Cheating. When you take a quiz, you can't use the internet and you can't use your phone. You can't use your notes. Same thing with exams. You can't use anything to help you answer questions. And we go through a very strict process of taking exams. Okay. I described to you what plagiarism is in one way. Another way is if you go online and find an article to read and to use it for your discussion homework, and you don't use the reference for that article, you're taking credit for somebody else's work, and that's plagiarism. You have to list at the bottom of your submission where you got your information, the reference to the article, the author's name, the date, the name of the article, and the publisher. Within your submission, you have to use citations, the author's name, last name, and the year. Anytime you're pulled a thought from that article. There's an announcement that shows you exactly how to do that. Okay. Forging anything. We've had students in the past that submitted NCLEX questions. You can't do anything early. If you do NCLEX questions that are due at the end of week 3, if you do them during week 1 and you alter your PDF and put a different date on it, that's called cheating. That's called altering assignments. And if I find out, if I figure out something's not right, you'll get a 0 for that assignment and you'll have to meet with me. It doesn't do you any good to cheat. It doesn't help you provide good care. If you try to use shortcuts or do things that doesn't show honesty, you're going to carry that habit into your practice, and you're not going to be concerned about patient safety. And quite honestly, I wouldn't want you to be a nurse. I wouldn't want you to be a nurse taking care of me if you weren't honest and you didn't care about safety. So don't do those things. Just decide now you're going to do your own work. Even if you have to ask me to meet with you 3 times a week so you can do it on your own and you need my help, I would rather you do that. Besides, you would learn a lot more doing that. All right. So there's a lot of websites that claim to know and have answers to exams and quizzes and give you hints and share their documents with them. But like Studocu, Course Hero, Stuvia, and there's a lot of them out there, but they're not reliable. They have not been validated by a professional organization. They've not been published. Okay, so they're not reliable. You're going to find a lot of errors. Do not rely on them. I'm not saying don't go in it and look at stuff, but just know you're taking a risk. You're taking a risk. Artificial intelligence. Do you know much about it? How many of you know much about it? A lot about it, or some about it? Do you, Megan? Do you know that there's an app that can take notes for you during class?
Oh,
I don't know what.
no, I
Firefly.
didn't know that.
There's one that's called Fireflies, and I had a student that used it, and I don't mind if you use it. Let me tell you, you won't be able to use it during quizzes or exams. So that's most of the weeks. Number two, you're going to be able to retain more information if you write your notes out. It's a natural neurological process that occurs in the brain that if you write down what you want to remember, it tends to be retained. And I know when I took notes, when I was reading a book or listening to somebody, rarely did I have to even go back to the notes because I could remember things from when I wrote it down. Okay. But I know you get a lot of information. I wouldn't be able to do that now. But so artificial intelligence, you can't use it for your assignments. Okay. And we have ways of checking if it's AI. There's plagiarism checkers, there's AI checkers, all kinds of things. So don't do that. If you use AI in your work, you're not pulling necessarily from the textbook. Okay. So, and it's not always right. Now, I do use AI, but I'm very cautious. You know, my pen is going to be the last thing that's going to be on that page, or my typing, not AI. Okay. I use Grammarly for grammar and that sort of thing. It's good, but it's not always right. It doesn't always express what I'm trying to express. So you certainly can't use AI when you're in a clinical situation because you can't take pictures of anything. You can't record this class. I do the recording and I'll share it with you. And that's for student privacy. Okay. When I post the recording on YouTube for you to look at, I don't have student pictures on that. Okay. Because I have to protect your privacy. Okay.
Dr. Zeller,
Yes.
I just thought about this, but we can't do work early. So with that being said, how early is too early to submit our homework for each week?
Okay, so your homework is available, will open up and be available for you to access the Sunday before the week. Like this coming Sunday, I got an eyelash in my eye. This coming Sunday night, you'll get week 2 content. Or I should say you have week 2 content. You'll get access to week 2 assignments Sunday night.
Okay, and so as long as it's open, we can submit it whenever without
Yes,
getting a
yes,
10% deduction.
yes, yes.
Okay, I was just making sure like we didn't need to wait a few days or something like that.
No. No. When
Okay,
it's available, you can access it and finish it and do it and complete it.
okay,
And you have
thank you.
until the following early Monday morning to get it done. I recommend that students wait to do NCLEX questions until later in the week because you want to get all the content before you start answering questions. Sim charts, same thing. You want to kind of wait a little bit until after you have class. But I know that your schedule might not allow you to do that, and you might need to do it before class some weeks. Okay.
Dr.
To be
Zeller, a quick question.
Yeah.
Sorry, my dog is barking. I noticed on the emails that the discussion post, it said something about doing it on a Word document and then submitting it so it wouldn't be like directly on, I'd have to do a Word document and then like attach
Uh,
it. Is that
yeah,
correct?
cut and paste, cut and paste.
Oh, just copy paste it. Okay.
Yeah, just copy and paste it on if you want to. Now you can do it directly on, but I would think I would want to save it for your files. Save your work that you do at Fortis, for reference later on. You never know when you want to look back and think, wait a minute, I learned something about that. Let me look at my notes from OB, whatever. But that's up to you. Yeah. Yeah. And not only that, but Word will check your spelling and all that stuff.
Okay, cool. I just wasn't sure if it had to be submitted like as an attachment or something.
No, no, no. So to be counted present, you're here, you're on camera, you're sitting up, you're not lying down in your pajamas with your phone. I had a student do that once, ignored me, did not participate, laying down on the couch with the phone, would not respond. I finally removed the student from Zoom and he couldn't sign back on. Just a real reticent um, attitude, not good. And like I said earlier, you can't be in a car, can't be driving, you can't be riding, you can't be sitting in a car. And the reason is you need to take this class very seriously. When you go to campus to class, do they let you sit out in the car for class? Does everybody just get in their cars? No. So online class, you need to be in a chair, at a desk, or in a position that you're upright looking in the camera. Okay. All right. If you want to use background screen like I have, you can during class, but not during a quiz and not during an exam. Okay. Because I need to see your surroundings. I don't expect you to have a clean background. I mean, I'm in a room I'm attached to my house, but it's not my best room to be in. So if I were to show you my room, you would think, oh, I don't feel so bad. So you don't have to have a really nice background for class. That's not what we're here for. Okay. So I do take attendance from the Zoom log. So I don't have to sit here and write down, she signed on here. There's no way I could do that. And so it tells me when you sign on and sign off. Now, during class, if you have to get up and go to the bathroom and you're not going to be gone that long, I'm not worried about that. But if you're gone for a while and you haven't come back, or if you're off camera and I call you, say, where are you? And you don't respond, and it keeps going, I will remove you because you're not here, right? You're not here. So attendance is taken in 15-minute increments. So if you're 5 minutes late, you're 15 minutes late because that's how much time. Even if you signed on at 5 after, you're not really going to be counted present until 15 after. Okay. And that's going to add up quickly. So don't get in the habit of being late. If you are on campus before this class and you want to drive home so you can be home for OB class and you're late, or if it's going to take you too long, or if you get stuck in traffic, or if you have a breakdown or a flat tire, then you're going to be late. So don't take a risk. You might want to stay on campus, especially if it's an exam time. So if you don't show up for class at all for 2 weeks in a row, and you don't do any homework for 2 weeks in a row, you could be dropped from the class without any notification. Okay. So if you know you're going to be gone for 2 weeks in a row, that hurts. That hurts your attendance and you're going to really miss out. So try not. There's no makeup classes. There's no way to do it physically. It's not feasible for your schedule or mine. So I recorded in Campus Link, and Campus Link will keep track of the percentage of your absences. if at any time during the term you want to know what your total absent percentage is, I can let you know. You will get a letter. It's an automated, generated automatically when you reach 5% absence. When you reach 10% absence, you'll get another one. And you probably get one at 15%. Don't get that high, okay? So if you reach that 20%, and at the end of the term, after you've taken your HESI and your KGA is 82, guess what? You get bumped down to 72 and you failed the class. So you don't want to miss class. It should be obvious that just like when you're on campus or just like when you're on a job, when you're in class on Zoom, you should be consuming no alcoholic beverages. You should not be smoking. You should not be vaping. You should not be using any illegal or some prescribed substances that can alter your judgment. Okay. It really hinders your learning. So avoid that during class. So, I made a comment here that a healthcare nurse should be alert and ready to act. Using any substance that alters your judgment, puts your patient's safety at risk. You are setting yourself up to lose your RN license that you have sacrificed so much to obtain and worked so hard. You do not want to take that risk. Okay, professional appearance, you don't have to wear your uniform, but I'm not asking you to dress up. Just, what everybody is wearing right now is fine. Okay. Just don't wear something that's real. Women don't wear something that's real low cut or super revealing. Now, I know some of you in Pensacola and Cutler Bay, it gets hot. I understand that, but just make sure you're covered up. Try to look a little, whatever you would wear to work, if you consider it okay, if you were going to work, not as a nurse, but outside of that, if you're working at Starbucks or at a fast food restaurant, or maybe in another job of sort in an office, you're not going to wear something very revealing. And I don't want to see that in this class either, because it shows that you're really not being professional. Okay. No pajamas. If you are admitted to the hospital, you cannot be on Zoom. We've had students in the past show up from their hospital room with their hospital gowns on because they didn't want to miss class. We don't do that. It's a privacy. Even though we have your permission, it's still HIPAA violation. So if you're hospitalized, just let me know. And you can't make anything up unless you get permission from Dr. Brown, and then we'll work with it as we go. So the next two slides talk about keys to success. The first most important one, the two most important ones about this is to plan your weeks. Make a calendar, plan your week, and be organized. It'll help you a lot when you actually start working as a registered nurse. How many of you are LPNs? Or even MAs, medical assistants? Anybody that's got a job that requires that they, keep moving, have a list of people that you're watching over or taking care of. You've got to be organized. You've got to know how to prioritize what needs to be done. And you need to learn the same thing when you're in your education so you can practice. And, that's something you could ask one of the nurses when you're in clinical in any of your classes. Ask a nurse, how do you organize yourself? She might not want to talk to you. I know some nurses are pretty bad about that. But find someone and ask them for those things. Say, how do you organize yourself? Some nurses have little pads that they use and write down about their patients, which one they need to see first. Okay. second most important thing is ask me for help. Okay, I have had students in the past scared to death of this class. And one in particular, I'll remember her. She says, I don't want to fail your class. I heard horrible things about OB. And she contacted me and she wanted to meet with me every week and answer questions and go over what she's supposed to be learning. Every week she wanted to do this. And I was glad to do it. So if that is something you want to do, I'll set up a schedule with you and we can just, whatever fits your schedule. I'm available evenings too, or in the mornings. I'm kind of pretty Thursdays, Tuesdays, Thursdays, and Fridays. So you should be able to find some time in there with me. And then other things is, be here, attend any extra Zoom sessions, go to exam reviews, tutoring, like I said, get your homework done on time. You can't neglect your homework. I had one student, just one this term, past term, that did not pass the class because she didn't do her homework. She didn't do enough of it. She missed too much. And it's not that knowledge-wise. In fact, she did fairly well on the HESI, but she didn't do her homework and it knocked her grade down. So, okay. Keep in contact with me. If you don't feel, if you're not comfortable with navigating your computer, make this the term that you learn how to do that, and I can help you with that. Make sure your internet is reliable. And so far in this class, doesn't seem like anybody's having any trouble with a reliable internet. Okay, so let's keep that in mind. If you have trouble, then let me know and we'll try to troubleshoot. Find a quiet place for class time, somewhere where you're not interrupted. And I would recommend putting your cell phones away unless we're taking a quiz. Okay, put your cell phones away, turn them off so that you can focus. You can't learn and engage with your classmates if you're on your phone, even though I can't tell always when you're on your phone. If you are, you're distracted. Okay? Read instructions. So as I'm looking at OB calculations assignment for this week, some of you have already turned them in and I've given you feedback. And it's not necessarily this class, but I have 3 classes. I teach Mondays at 2 p.m., Wednesdays at 2, and then tonight again at 5:30, I have another class. And what I'm seeing is some real simple thing, and that is if you don't read the instructions for the problem, you might miss it. If it asks you to round and you forget to round, you miss it. If you answer in milligrams and yet it asks you for the answer in grams, you miss it. If you add the unit of measure, you're supposed to just put in the numerical value, not 12 mLs, but just 12. So if you add a ml, you might miss the problem. Okay, so read your instructions. Check your email at least once daily. Check the announcements every day so you don't miss anything. And submit assignments on time. Come to class prepared. So these are some other things. So let's look at grading components. How you get your grade in this class. What's KGA mean? What do I mean by KGA?
Key graded assignments.
Key graded assignments. Now, you have unit exams, 3 of them. You have 1 HESI, and you have 5 quizzes. Those are your key graded assessments. When we calculate the results of all of those using weights, in other words, the unit exams are going to have a more of effect on your KGA than your quizzes or the HESI. Okay, so that calculation, total calculation, has to be 78% to pass the class. If you don't get a 78% after you do all your quizzes and your exams and your HESI, and you didn't reach 78%, you have to repeat the class. Okay. And then your homework is added in on top of your KGAs after you reach 78%. If you don't reach 78%, you don't get credit for any homework. So you have to, your grade will be whatever your KGA is. So looking at this chart, do you notice that the homework assignments, the NCLEX questions, SimChart cases have more value than any other homework? Do you see that? The discussion questions, and there's 5 of them, your OB, calcs, there's a teaching plan, and there are 2 evolved practice exams. They're only worth 1% of your homework grade, not much weight. So my recommendation, and I urge you, always complete your SimChart cases first. If you skip them, it hurts your homework grade. No matter if you even do all your discussions and all your OB calculations, your teaching plans, it's not going to help. You need to do your SimChart cases first. Get that done. And then if there's a discussion question and you miss it, it's not going to have that much effect on your grade. Okay. And most students spend way too much time on discussion questions. So I'd rather you spend more time on the SimCharts. And then your NCLEX is the next thing. You only have 4 sets. I know in Med-Surg you have to do some every week. In our class, you do a set of NCLEX, 50 of them at one sitting in week 3. They're due right before week 4 exam. In week 6, right before exam 2 in week 7. So you're assigned in a set of NCLEX questions the week before each exam. Okay. So keep that in mind. Your priority for homework is to do your SimCharts, and you're going to have one every week starting next week. How many of you are comfortable doing the SimCharts? No? Ty feels pretty comfortable. Okay. All right, Natalie. So why are you comfortable, Natalie? How did you figure out how to do them and you feel comfortable with them? What's your process?
Honestly, I just kind of try to make sure that I'm reading all the information that's available so that way when the questions are being asked and I kind of know exactly where to find everything. And for example, some of the questions they'll ask you to input information, and this is based off of my other class. I don't know how the questions will be framed in yours. But it'll ask you to input or chart certain information. So at the top, there's a search bar. And then in that search bar, I would put in, for example, a vitals. So I would just put in the search bar vitals, and then it gives you a drop down menu. And then there, I would be able to see exactly where I would need to click or go to in order to put in that information. So that search bar is really helpful.
Okay, the search bar. Use the search bar in your SimChart. What else? Ty, how did you figure it out? You have anything to add?
No, I agree with Natalie. I think the search bar has been very helpful, especially because you read the information, but sometimes it is a lot of information and you can't remember everything. So it's good to have that search bar so you can find exactly what you're looking for.
Okay, good to do. Now, and you don't have to fill in all of the charts, only what they tell you to fill in, right? Okay, all right. The grade you get is based on what? Is it based on getting all the charts done and doing the quiz? What is your grade for that SimChart based on? Anybody know?
Is it? I think it is based on what you do, like how many like entries they ask for, like your you know, whatever inputs they're wanting.
Okay. Actually, it's only based on your quiz score. But your quiz score is going to be higher if you do like Ty and Natalie say, looking for the information and putting it in. You're learning. That's the whole purpose of doing sim charts.
I have something to add to that.
Yes.
So on campus, we started sim charts last term, and this term they are no longer doing them in a couple of classes because actually took a video and sent it to one of our teachers. But so I got a perfect score on my quiz, and my sim chart grade was like a 40 something percent. And then another thing with the sim charts was I took a video. It was saying, hey, of the medicines that have not been given on the MAR, which medicine would you give for pain? And the only medicine that was there that hasn't been administered already was not even one of the answer choices. It wanted you, the only answer choices were medicines that had already been administered, which is not what the question was asking at all. And so as far as navigating the sim charts, I feel like everybody's probably got that, but the sim charts kind of feel like we're set up for failure in a sense. I know that everybody last term, we all pretty much had the exact same problems. And so I'm
Yeah.
not sure how to navigate
Okay.
that, but
Okay. So then that would be placed on that's my burden, because I'm responsible for going in there and looking at and verifying your grade. Because there were times I did notice that students did the quiz and I saw it, and yet it showed on Canvas as 0 or a lower number. So it's if you see a number in SimChart and you know you did better, and you only get one attempt, it's the very first one, and you know you did better, you need to make sure that it's corrected. So, but just if you don't see it corrected, then contact me and let me know, okay? Because I have to look into that, and I need that feedback, because I'll let the curriculum committee know that as well if there's problems. Okay. That was really good input too. Anything else?
I actually didn't know that that was like happening, but I definitely did a few sims last semester where I was like, how did I get a 40? Like that doesn't even make sense. And then I thought at the moment it was maybe because I was like the way I was inputting, like for example, if it said like to chart XYZ, but it was more of like a typed out thing, like the S bar one, for example. And then I had to write the whole, I was like, okay, well, maybe it's because I didn't do that properly and it like read what I and it wasn't right or something.
Uh-huh.
I never brought it to my teacher's attention, but yeah, I feel like I experienced the same thing with like being confused on how I would score so low if I would get everything correct on the quizzes. So
Okay.
Yeah, and I'm gonna just confirm what Brittany has said because that exact scenario happened to me and I tested it. I did only a quiz and I got everything right on the quiz, but because I did absolutely nothing in the chart in the sim chart anywhere, it gave me a 0. So part of that grade I do believe is based on what you're actually doing in there because the professor's supposed to go in and also give you feedback. Like so but yeah, so I'm going to confirm with Brittany too. Like and I know I did one where I did really well on the quiz and I also did what I thought it was asking me to do in there and I still ended up with like a 47 and I have no idea why.
yeah, so just because we word something differently than what it wants, we get a worse score. So it's, I guess, more of like a dialect thing between everybody.
Okay.
I got a
All right.
I had a quick question on all that though, just so that we can clarify, because last term it was told to us that like our professors couldn't even get into the sim charts on their, sorry, my
We did have trouble getting into them
Okay.
because it's a new product. We did have some trouble.
Okay,
Yeah.
I just wanted to like clarify with that, because it was like they were saying like they couldn't get in at all, and like we would have to show them like that we did it. And there was just like some kind of unfairness going on with that last term. So sim charts are a little PTSD with sim charts from last term for sure.
Well, yeah. So just know that this term, if you get a grade that you know isn't right, you need to let me know, because yes, I'll be looking at them and I'll be giving you feedback, but you know, we need to correct them as soon as possible. So just let me know. Okay.
Well, I can say
Because
that I
I can see
appreciate that
what you
because
do.
we did not get that justice last term for sure.
Right.
So the fact that you're willing to go in, to help figure it out, I just can say
Yeah.
that I
You
know that
feel
we
better about
appreciate it.
that.
Yeah.
Yeah. You feel much better about it. Okay. It's really good. You know, we need that feedback about the things that we offer our students. So, okay. I'll look into that. So, yeah, I was told initially when I was learning about the program and doing my own study of it that I thought, yeah, you have to fill in all the charts and do the quiz before you get a grade. And then I was told, no, you don't. You only have, only based on the quiz score. But I'm hearing other things. I think there's some glitches in the software. So we'll just keep our eye on it this term really close. Okay. All right. All right. It's been an hour since we've met, and I try to give students breaks every hour, like they do on campus. If you're in a multi-hour class like med-surg, you don't go on for 3 hours. You take a break, right? So let's do a 15-minute break, and we'll meet back at 15 after the hour, whatever your hour is. Okay.
Do we need to close off or just turn
You
our
can just
cameras
turn
off?
off your camera or whatever you want
Okay.
to do. We'll wait for everybody to sign back on before we get started again. Okay. Anybody have any questions so far? You think of something you want to talk about again before we continue on? Okay.
I do have something.
Yes.
I'm a very much okay. I work two jobs. I have two kids, and life is life. And so I'm a very much get ahead person. So why is it that we can't work ahead?
Think about how much time you would spend on a sim chart or NCLEX questions if you haven't done any reading about that particular subject. Let's say you did a bunch of sim charts and you're doing one on placenta previa, and we're still learning about postpartum nursing. We haven't even, you would spend so much time preparing that because you don't know anything about it. You haven't read about it. You haven't looked at the resources. It's a much more effective tool. Your homework is if you completed the week that you're discussing that topic. Now, the sim charts don't always align exactly with our classes, but the purpose of homework is to support your learning of that particular content. So, like the first set of NCLEX questions are due at the end of week 3, right? Right before the week of the exam. And the NCLEX questions you're supposed to be answering cover the antepartum and the intrapartum. And that's what your exam is based on. If you were to do those tonight, because you have some free time, it's going to be hard for you to answer intrapartum questions because that's not till week 3. Okay, so you would spend a lot of time hunting for answers and probably not remembering as much. That's
Okay.
usually the reason we give you homework assignment is to support your learning. And the most effective way is to study and learn it the week that you're learning it in class. Okay. But I do appreciate your busy schedule. Okay. So, Brittany, you're one example that if you've had a sick child that week and you are behind on homework, you communicate with me. I've had a child with a fever this week and I've had to take her or him to the doctor. I'm behind. And usually what I do in those situations, I said, okay, we'll try to get your homework done then by Wednesday. I'll give you a couple extra days and not penalize you for that week's late homework. Okay, so that's what I mean by communicating with me about what's going on, and so that I can support you. I don't want you to just give up because you can't get it done. And speaking of homework, does that answer your question, Brittany?
It does. Thank you.
Okay. Okay. Because I know some students have not only jobs, but there might be other people in the family are depending on them for income. You know, if you're a single mother or if you're caring for another family member and you have some obligations, it does cut into your time. I know that. Homework. So homework grades, let me put it this way. After you take your first quiz next week, you will begin to see your KGAs in Canvas. Okay. You won't see any homework grades on Canvas yet. I mean, you'll see them, but they're not going to be calculated into your total grade yet. I won't tell Canvas to calculate them until week 6. Week 6, you'll see your total grade. So if you've been doing your homework and you did well on the first quiz or 2, then you'll have a good KGA. Week 6, if you haven't been doing your homework, your grade's going to drop. Okay. So it just kind of reminds you to do your homework. Okay. And then I'll turn them back off in week 8 and you'll just see your KGA. So as a reminder, your homework is due Sunday night Pacific time at 11:59. If it's 2:01 Eastern time or Central time, 3:01 Eastern time, and you haven't turned it in, it's late, and I deduct 10% from the grade. So on a sim chart, let's say you got a score of 12, and it's late. So if I deduct 10% of that, that would be 1.2. So your score would be 10.8 instead of 12. But you know what? That's better than 0, right? That's much better than 0. So do your homework. Even if you're running behind and don't get it done, do it the next week because you can still get credit the following week. And any credit is better than 0, not doing it at all. If it's more than 8 days late, you don't get any credit. So you have that extra week to get it in. And you really need to let me know. In other words, if you don't get it in, you need to ask me for permission to submit it late. Okay, so the exams and the quizzes have to be proctored. In other words, I have to watch you taking the exam. Next week, and how we do that is, does anybody know how we do that? How we accomplish that on Zoom?
You're going to
Okay.
have a device set up for Zoom, and then you're going to be taking the test on a lockdown browser on another device.
Okay. So yes. So ExamSoft actually locks your ability to surf the internet. You can't get online during exam on an Exemplify. So you need a device that you can take your exam on. Now you can use an iPad or some kind of pad that's comparable to a computer. You have to use either Firefox or Chrome browser. You can't use Microsoft Edge or Safari. You can't use those. And then you need a second device that you can be on Zoom with and a camera that's working. Both devices have to have cameras because Exemplify will want to take your picture and verify your identity. And then your phone is going to be set up beside you, and I need to see your hands and your computer during the exam. Okay? So you need two devices, and we're going to do the same thing for quizzes and exams. So next week, we're going to do our first practice run. Okay, so have two devices. Okay, you can use your computer as for your quiz, and you can use an iPad for the camera for Zoom. Now, during quizzes, since we're not on ExamSoft, you will have the ability to get on the internet at other websites, but that's cheating, right? To get answers, and it might not be the right answer. And I can tell in Canvas by your log taking a quiz when you go to another website. It keeps track of you jumping in and out of the quiz. So if you click on another page, I know when you do that. So you'll get a 0. If I see on your log that you're not taking your quiz, you'll get a 0. So don't do any surfing. Don't get on your phone and do any surfing. You're not going to be allowed to wear anything in your ears. No headphones for quizzes. Okay? You can wear some of those deadening earplugs for sleeping. You know, sometimes you can get those earplugs. You can use that if you want, but nothing else. And no smartwatches. All right. We'll go over that again later. Your quiz next week will be at the beginning of class. The quiz is on Canvas in module week 2. And there's a link there that says quiz 1. And it's timed for 15 minutes. There are 10 questions. Most students rush through it, which I don't really want them to do. So you have a minute and a half for each one. So that's plenty of time to answer a question. Rarely do students run out of time with quizzes. Every quiz that you take, there's going to be one math question. And there are going to be 2 questions so next week for your quiz, there are going to be 2 questions that come from chapters 6 through 10, which is your reading for next week. The rest of the questions, 7 questions, are going to be from chapters 1 through 3, or the things that we talk about today. Okay? That's the same format. So the second quiz, 1 math question, 7 questions from week 2 content, and 2 questions from week 3 content. So that's kind of the way it goes. So if you're not in class on time, if you're late for class, you'll probably get a 0 for the quiz. So you definitely want to be in class on time. For the exams in particular, you're going to have a government issued photo ID or your Fortis ID. You can use a driver's license, a passport, any kind of government issued ID. All right. There are 50 questions on the exam, so you have a minute and a half, 5 math questions on the exam, and the rest of them regular multiple choice questions. Now, if you want to, let's see, there's one on proctoring. Oh. If you would rather be on campus to take your exams and to have a faculty member proctor you, what the process of doing that is, you have to be the one to find a faculty proctor, a faculty member on campus who is willing to sit with you while you take the exam so that they can proctor you instead of being on Zoom. Now, if you want to do that, you have to tell me 72 hours ahead of time that you have found someone to proctor you on campus. And that proctor then knows to contact me so I can give them the access code.
So
you
they
can
have
do
to
that.
stay in the room the whole time. Sorry. I have a friend who wanted me to ask this question. So they have to stay in the room the whole time, even like if they have accommodations, or can they be put in the room by themselves because of the accommodations,
They can be put, actually, you're right. They can be put in a room by themselves. You know, they have to go through the checks. They can't have their phone. They can't have any notes and all that sort of thing by themselves. Yeah. Okay. And by the way, I'm glad you mentioned that. Any of you who are repeating the class or who are re-entering Fortis, attended here before and are coming back, or have accommodations, let me know. Okay. Let me know. I have to make adjustments at my end. So just let me know. Okay. So if you want to go to campus, you want to find a proctor, you need to give me 72 hours notice. Okay. And then you'll be there and you need to, and the proctors know this, you still be taking the exam the same day and approximately the same time as the class takes it. You will need to then return to Zoom for the class, because exams are only like an hour and a half, and we still have time left over in the class to actually have a class. So you'll have to sign on to Zoom at that time. You can also go to campus and just to use their internet and your computer and be on Zoom on campus. If you want to not worry about distractions during exam or worry about losing the internet during exam, anytime that you don't have internet, if you can get to the campus, you can always use their internet. Okay. I'll be talking about these things and reminding you. I will be sending out a long list of exam instructions in week 3. Okay. To kind of help you out. If you're in the hospital or you're very sick when it's time for your exam, then you need to let me know. You probably need to be seen by a provider, so you have some documentation, so that we can schedule your exam on a different day. Exams can be made up with communication. Okay, in other words, communicate with me if you've been really sick, but I need documentation. Okay. If you don't show up for an exam and you haven't communicated with me and you don't tell me anything, you get a 0 for the exam, and that means you fail the class. Okay. All right. So it's best, like I said at the beginning, it's best to communicate to me before an exam if you're having computer issues. There's a way of checking your computer compatibility on Evolve. That's easy enough done, and I can show you that. So remember, the quizzes are on Canvas. It's just a link in your module for the week. But ExamSoft is your Exemplify, and you don't go to Canvas for it. Your HESI exams occur in week 11. Okay, every campus probably has a different day that they're taking it. So week 11, there is no class time. It's just your HESI. Okay, so there's no class in week 11. And again, I will remind you of that. And then week 12, you do, or during week 11 up through Monday night, week 12, you will be required to get your remediation complete to get your HESI score. It's mandatory. Okay. So planning your study, plug in your classes and your work schedule, your simulations, your clinicals, your labs, all into your calendar. Plus, Brittany plugs in her 2 jobs and her child care, her when she has to cook, when she has to do everything else that she has to do, bless her heart.
I have to put on there when I'm able to breathe.
Yeah, when you can sleep, when you can breathe. Yes. Okay. And then plug in your assignments that are due for the week. You can plug it in anyhow you want to do that. So your OB math, like I said, some of you are already doing it, but remember, you're only putting in the number, just like you'll do on the exam. You only put a number in. If it asks you to round it. If you're working on a calculation and you're using your calculator and you get like 7 digits past the decimal point, don't round until you're at the very end of your calculation. Okay. And then at the very end, round according to the instructions. All right. Don't use Google for formulas. There's a lot of errors. I know students who have gone to Google to ask how many kilograms are in a pound or how many pounds in a kilogram. And Google will tell you a wrong answer. There are 2.2 pounds per kilogram. 2.2 pounds per kilogram. And there will probably be a quiz question about that. Okay. NCLEX questions. In week 3, I actually give you a picture of how you, what questions that you are supposed to do for week 3. So for week 3, it will be exam mode, 50 questions, content area as a category, subcategory, click maternity, and then drop down and pick only antepartum and only intrapartum questions. And you'll see that in the week 3 announcement. Okay, I'll have a picture of it for you. When you submit NCLEX questions, you have to do 50, not 25 plus 25. If you do 25 plus 25, you get a 0. And then if you want credit and you should want it, you have to do it over. Okay, so don't give me 25 plus 25 or 10 plus 10 plus 10 plus 10 plus 10. Is that 50? Anyway, and then when you save, when you're finished the questions and you get the results, you have to save those results as a PDF on your computer. And you have to name that file nursing 202 underscore whatever week it is underscore NCLEX underscore your first initial, your last name underscore, and the date. So 01 12 or would be 23 or something, 2025 or 2026. Okay. It's in the instructions for the homework. It tells you in the homework instructions right here how to do it. So when you get the quiet and you get ready to submit your PDF, it tells you exactly how you should submit it. All right, that's NCLEX. Any questions about the NCLEX? Okay. No screenshots, no pictures. Get a 0 for NCLEX questions. The sim charts, you don't have to post anything. You just go in there, and we've kind of talked about them already. And your work in the sim chart will populate Canvas automatically, and I'll have to double check them and give you some feedback. And you could only do it one time. I know the CJ Sims, you could do it more than once. Any of you do the CJ Sims? Have it in the past? You could do it multiple times, but the sim charts you can't. So you have to sit down, say, I'm going to spend 45 minutes doing this sim chart or whatever time it takes. I had one student said she spent 10 hours on a sim chart. I'm thinking, what did you do? Rewrite it? I don't know what she did. But she said she had trouble getting through it, navigating it. And then there's another assignment due at the end of week 7 called the teaching plan. And I have a special announcement for that and explanation. But I went ahead and put the rubric in here. Does everybody know what a rubric is? Yes. Okay. So for your discussion post, and there's a special announcement for that along with your NCLEX. You're going to go get an article. Let me do this. All right. So I'm in the announcements now of your class. And of course, this is my screen. It's not the same as yours. But the only difference is that there's more stuff on it. So what you see, I've posted a lot of announcements already for just information. You've got your syllabus cover sheet, which just tells you the information about the class. A chart of OB medications. And this will be helpful because it tells you what they are. Okay. And then the homework grades I've told you about. And then perfusion. This is a critical concept that you really need to understand. I actually have a PowerPoint here for you. And you can read about what perfusion is. And the reason I really want you to understand it is because if you understand perfusion, you won't struggle quite as much in OB. So what I have decided is that this coming Sunday night, the 11th, I'm going to be on Zoom at 7:30. I usually don't do a week 1 review, but I decided this term I'm going to do one. And what I'm going to do, I'm going to take you through a real short PowerPoint, and we're going to talk about anatomy and physiology, basic principles, and some math. Okay, so if you don't feel comfortable with those and just want to brush up on stuff, try to come Sunday night. If you can't, I do record. So we're going to do that on this coming Sunday. And I do have usually every week, except for exams. Sorry, I'm kind of jumping around here. For exams, so you have an exam in week 4. So at the end of next week, I will send out a schedule of when instructors are going to have an exam review. In other words, each of the instructors will have a day and a time that they're going to be on their Zoom, and you'll have that information to go over concepts of the first exam. So it gives you an opportunity to ask questions and just kind of review things and study for the exam. Okay? So each instructor will have that. I have mine on Sunday nights. I do everything on Sunday nights. Okay, so let me go back down here. So submitting homework assignments and then discussion assignments. You can look in here and see specifically how to do it. Now, I don't want you spending hours on discussion assignments, right? They don't have a whole lot of value, but they do have some value and they can be fun. what I have done for you in, well, let me go back. I'm sorry, I'm just jumping around. And then submitting homework assignment. And then there's a math video in here, OB math. If you want some extra help with math, you can look at that. So every week in your announcements, there's going to be a specific announcement for that week. I call them guides. So for this week, it was guide to week 1. And you can see there's a guide to week 2 here already. And I'm going to put guide to week 3 in because that's the content for exam 1. So this week, and we're going to look at it as a student, what you see is, this is a different class, a Zoom link. I'll always have the Zoom link on the week's announcement, and then tell you what to do, give you instructions, what to do, what to download, what to read, what to watch. And then here are these notes. Okay, these are the notes I told you about earlier, that when you're reading the textbook, I have prepared notes for you. So you can print those out. It's 1 or 2 sheets. And as you're looking at the textbook, you can add your notes in to really try to make sense of things. I did that for the first 5 weeks, 6 weeks. I can't even remember. After that, I didn't do it anymore. But I wanted to give you a jump start. Okay, so I made those for you. And then there's also an article down here if you want to read it. It's really good. I usually put videos in here. Down at the bottom, there's extra PowerPoints and videos for you. And then I remind you what assignments are due for the week. So that's every week I do that. So guide to week 2 is in here. So you can, if those of you who want to really get going, I have guide for week 2 in here. And this next week, we're going to talk about the antepartum patient, the patient who gets pregnant. What do we do? Okay. Anatomy and physiology of mom and baby. So this is a heavy week. Okay. Once again, the Zoom link, and then the notes or the salient concepts, same thing for chapter 6, chapter 7 to 10. And then there's a perfusion PowerPoint. And then these, before class, these videos at the top, the first 2, the physiological changes and the maternal nutrition, those are my pre-recorded lectures. Okay, so you can actually watch a full lecture before you come to class, and that'll help you on any quiz. So, and then here's some more PowerPoints. Those are my PowerPoints. And then I remind you about last week's homework and what you need to do this week. And then you will have your quiz. And then at the bottom, a bunch of videos for you. So like I said, we have tons of resources for you. And there's really no reason for you to go outside of Canvas to get any resources.
I have a question.
Yes.
So we have access to all of the OB teachers' material. With that being said, our quizzes and tests, are we all taking the exact same thing? Or, okay, that's why I was like confused if we need to be studying some of the other teachers' stuff as well, because it's maybe worded differently on the tests.
You might find that another instructor's style is more helpful for you. So that's one reason we want you to have everybody's notes.
But it's all being taught the same.
It is all the same content. Yeah.
Okay.
It's all the same content. That's why sometimes just listening, I really like Professor McBride's, or I find Dr. Roberts' material more helpful for me. And that's great. You can use her stuff if it helps you more. And that's what these resources like instructors, weekly resources, this is where they're found. So week 1, here's Professor McBride, Dr. Roberts, Professor Shumate, Young, and then mine. And then week 2 is here, all of them. And then week 3. So we put all 3 weeks in at once because this is the content for the first exam. Okay, so you can go in here and look at this stuff. It's a lot. But, just kind of pick and choose and see what you like. And then there are just plain resources. I really wish we could put it all on one page, but it's a lot. So most of these are resources like a picture or something. And then down there's flashcards for weeks 2 and 3 if you like flashcards. And then there's some games that some of the professors have recorded that are in here. If you like Kahoot games, you can click on this recording of a Kahoot game. Math videos down here specifically for a certain calculation. And lots of videos. And then there's a list of practice questions. The one student that wanted to meet with me every week, she wanted to go over the practice questions every week. And that's what we did. Okay. Another thing I want you to know is that other than all those resources, and that I have reviews on Sunday evening, there are other optional sessions. Professor McBride has on Thursday, on the 15th, that is during week 2, at 9:00 in the morning on Thursday, she has what she calls a game day. And this is a live session where you can join, and there's the link here to her Zoom right here. You just get on her Zoom on Thursday morning at 9:00 if you want to, and play that game with her and the other students who show up. Okay. And then, so you can look at the optional learning sessions. Because there is so much stuff here in the announcements, I will often send you an email reminding you what's coming up that you might want, because rarely does a student have a good handle of all these resources to be able to plug it into their calendar. And, if I send you an email real quick on Wednesday night, say, hey, if you can, go to Professor McBride's game morning tomorrow at 9:00. So I will remind you so that you don't feel like you're missing out, okay? All right, so I know by now you're feeling overwhelmed, right? Yes. Any help? Anything at all? So in your modules, there's Course Cafe and the Course Welcome. And I put in here an article for your first discussion for you. So you don't have to look for one. And I've also given you some websites where you can find articles. Now, Google Scholar is excellent as long as you make sure you choose ones that have been published within the last 5 years. So I found an article here. It's called Innovations in Preconception Care, Optimizing Health for All Individuals. And I gave you the DOI number. So you just click on that DOI number and paste it into your address bar, and it takes you to that article. Medscape Obstetrics is free. You can find articles there. And another one, March of Dimes, is another great place, and I'm going to add it in here, is another great place to get information about maternal health care. World Health Organization and WHONN. Right now, I would ask you to avoid any government websites do not access the CDC or anything in the government. It's all being revamped by a different administration that, and we have to be, as nurses, we're scientists, aren't we? We're scientists. And we base clinical decisions on research that has been done by professionals, not by a group of people who are not scientists and do not use the current literature or past literature to make clinical decisions. So that's why I'm asking you not to access the CDC or any government, not even the Women's Health government website. There's plenty of other websites that we can access. So the World Health Organization is a great website. I've actually added that, and I'm going to talk about that in a few minutes. So you can go into the Course Cafe and post any kind of comment you want. This is for you to use as students to communicate with one another, if you want to do it this way, to talk about something you found or such as that. But I will be putting articles in here every once in a while for you, so you don't have to look. So when you have a discussion post coming up, check the Course Cafe. I might have an article for you to read. Okay, that's really good. All right, you understand that? Nikuria, why are you off camera? Anybody want to, where are you, Nikuria? All right. So that's your Course Cafe. So you have your sim chart practice, although you've been doing them, you probably don't even need to do that. Introducing yourself. So make sure you just let classmates know why you're in nursing. That's what that is. And you've got your OB calculations that are due by Monday morning early. And then you have a quiz next week. Now you can't access the quiz right now. All right. All right. Any questions? So speaking of the World Health Organization, as we discuss, in your book, it's got a page of dates of events in women's health history. You do not memorize any of those dates. Okay. There's a lot of information that you don't need and you will not be tested on. Okay. You will not be tested on the menstrual cycle, probably at all. Okay. So don't memorize the menstrual cycle. Have an idea what it is, and we'll refer to it every once in a while. So you'll get a better idea. But for now, don't memorize the menstrual cycle. So I looked this up today. So this is talking about how many women have died, the maternal mortality ratio. So they compared the ratio from 1985 to 2023. This is a World Health Organization. And the death rate, the ratio has actually reduced, but not much. Okay, not much. Not enough, right? So we know that the ratio is how many deaths per 100,000 live births. In other words, how many women have died after a pregnancy within that first year after, between per 100,000 live births. Okay, so between in 1985, 460 women died within that next year after giving birth. In 2023, 197 died. And of course, there's variables associated with that. Maybe not as many women got pregnant, or maybe they had an abortion. but it definitely has gone down. In the world, that's in the world. In the U.S., it hasn't been as significant. Okay. In let's see, 16.6% or 16.6. I guess that's a number. Yeah. So it hasn't changed much in the U.S. It's almost a flat line. It's the line at the very bottom. It hasn't changed much. So every day in 2023, 700 women died from preventable causes related to pregnancy and childbirth. Preventable. A maternal death occurred almost every 2 minutes, and the ratio dropped 40%. Of deaths dropped 40% worldwide. Just over 90%. That's a lot of all maternal deaths occurred in low and lower middle income countries. Well, that makes sense, right? They don't have the resources. They don't have the providers. They don't have the medicine and the capabilities at the higher income countries have. We know that skilled nursing health saves lives. We also know from your book and from other research that prenatal care is critical for improving pregnancy outcomes, for reducing the death rate. We know that regular prenatal visits are very important so we can recognize problems when they happen and not later after the effects are detrimental. So there's a indicator website I put down here where I got this information from the World Health Organization. If you want to save those websites, if you're interested in that sort of thing. When it comes to infant mortality rates by race, we notice some huge differences. Why are some babies dying according to their race? So we've got, this is the rate per 1,000, and I think this is what year? 21 to 23. This is an average, I guess, of the rate. How many babies died? And this is infant. So this is 1 year, up to 1 year old. How many babies died? You notice that the Black race is very high. And it's also true with maternal mortality. You'll notice, and we call this, when we see different ratios according to the race, we call this racial disparity. In other words, there's gaps. Why is one so much higher? Why is there such a gap of a difference in one versus another? And, we can attribute this to some things we know and some things we don't know. Sometimes it's genetics. For some reason, African-American women are more prone to develop preeclampsia, gestational hypertension, and things like that. So, but there's also some socioeconomic reasons, some, disparity. Maybe Black women in certain communities are more ignored. And there's an article in week 1, and I don't remember the name of the article, but I titled it, "What's Race Got to Do with It?" And it's about a journalist who experienced a hemorrhage. And she had, I don't know if it was her or her friend. It's been a while since I read it now, but the providers and the nurses were basically saying, "Oh, you're fine, you're fine." And they didn't really do a good assessment. And she just about died. And so that's what I mean by racial disparity, is when a patient from a certain race is ignored because of the local prejudices, those intrinsic prejudices that they have in their life. So as nurses, we are required And we should have an attitude that every patient is as valuable as the next. And we need to ensure safety of every single one of our patients, not just a certain color, a certain religion, or a certain culture, but every single one of them, not because they're old or they're a baby. The elderly deserve the best care we can give them, as well as a brand new baby, all ages. So how can we promote maternal and newborn safety other than doing what's right? We can implement standards of care. Okay, do you want to take another break? We have another 40 minutes of class. Do you want to take another quick break? Okay, let's do a 10-minute break. Okay, so let's say 15 after. That's 12 minutes. Okay, 15 after the hour. Okay, so promoting maternal safety, decreasing mortality of mom and baby. You know, the statistics are about pregnancy outcomes. So not only the death rates or the mortality rate during a pregnancy, but that continues for a year beyond delivery. So that's the kind of ratios they're looking at, because we know that most problems in pregnancy occur during the postpartum and months after that, because there's cardiovascular problems, suicide, and of course the infant mortality. And usually the infant mortalities are based on preterm babies and things like that. So standards, we have to have standards in any industry. If you work in manufacturing, you have standards. Things are made according to international standards, measurements, so that we're producing something that's going to work for more than one country. In the US, we have standards, and they come from research. They come from professional organizations that set up standards because it's based on quality of care. So what would you say is an example of a standard of care? Anybody have any idea? I know you talked about this in foundations, or at least health assessment, right? Give me an example.
What a standard of care be? Everybody gets treated equally.
Okay. So
no one
be
patient gets better treatment than the other because of their economical status or their social status, political, religious.
Okay. What about other standards?
Are we talking about like what you do as per protocol, like as soon as the baby's born, like you would dry them and you would do XYZ?
You know what? Everybody remember just what Megan said. As soon as a baby is born, you dry them. There's going to be questions about what's the first thing you do when a baby's born. You got to dry them off. Okay. Remember that for week 7. Okay. You got to dry them off. Yeah. So there are a set of standards for OB practice. Yeah. One standard would be doing an APGAR 1 minute after they're born. What is an APGAR? Another standard might be based on the facility. You know, all medications should be given within 30 minutes of their scheduled time. Standards also are documentation. So those are all standards of care. So if let's say you graduate this summer, right? Most of you are graduating by the summer. And you get a job and you're excited, you want to work with cardiac patients. And you're excited, you're going to work in critical care, your first job, you're going to be in critical care. You're excited. You're going to be in an internship. So let's say you're at the bedside and you have a patient that has a central line. In other words, it's up here, their subclavian vein, they have a central line, and the dressing is supposed to be changed every 24 hours or whatever the standard is. Let's say you're not sure how to do that dressing change. You were taught in school and you kind of reviewed it a little bit in your orientation to the hospital, orientation to the unit, but you're still not quite sure of it. How would you answer that question? In other words, how would you do it? What would you do if you didn't know for sure if you're going to do it right?
Admit
You need
you
to
don't know how to do it.
What?
Admit that you do not know how to fully do it.
Okay, admitting that you don't know how to do it. That you're right. That is true. You don't want to be so proud that you're just going to do it anyway because you don't want anybody to know that you don't remember exactly how to do it. No. So what would you do next then, Meredith?
Ask someone to teach me or show me or stand by me and teach me the steps
Okay.
that know how to do it.
How do you know that they're doing it right?
There's a standard operating procedure
Standard,
for
yeah.
everything at every
Yeah.
job.
Yeah.
Right.
It's got its
Exactly.
standards, yeah.
Policies and procedures, right?
Mm-hmm.
You're going to go to the policies and procedures manual and look it up.
Mm-hmm.
Because if you do it according to the procedure that has been developed by professional organizations and the facility, you're not going to be held liable for anything if you do it according to the procedure. Okay. So yes, you could ask someone to show you, but do you know if they're doing it right? You know, you don't really want to feel that way or be that way or suspect everybody, but to cover your own self and to take the best care of your patient, you need to look at the policy and the procedure. Okay.
Yeah.
All right. So how would you do now tell me, how would you define or give me an example of a negligent nurse? And what I mean by negligent is a legal term. Let me call on somebody. So you need to be on camera, right? Who wants to answer that question? Jennifer, you want to answer it?
Yes, I can answer. Can you hear me?
Yes.
So I think a negligent nurse would be, for example, if a patient is telling you that they're in pain, a negligent nurse would not be giving them pain meds because she would just be too busy doing other things. She wouldn't prioritize the pain meds.
Okay, good. Yeah. Or maybe didn't assess her pain.
Mm-hmm.
Tell me about your pain. Where is it? And you need to do physical exams sometimes to assess pain. That's what that article, What Does Race Have to Do with It, is about. Her pain wasn't assessed. Okay. Anybody else have another example of negligence?
Can you hear me?
Yes.
Yes. I'll say like not rounding on your patients often.
Okay, you're not checking in on them often enough. Yep. If you have someone with IV fluids running, you better be checking on that fluid site, right? That IV site. Okay, good. Yeah, good. And what has to occur in order for it to be considered legally negligent?
Harm.
Incident.
So harm has to come to the patient, whether it's temporary or permanent. Okay. Harm has to have occurred. Okay. So what about failure to rescue? That's another term. Your first 3 chapters, it's in there somewhere. Let's see. Who haven't we heard from? Tatiana. Are you really sitting in an area with all those beautiful plants behind you? Is that where you live? Where are you?
At home.
Oh, it's beautiful. Absolutely beautiful.
For failure to rescue is that if like they have like a code status, like full code, and they don't, I guess, go with the protocol for that.
Okay, that's one. Uh-huh. What about, let's see, let me ask somebody. Gabriella, can you give an example of failure to rescue? You're muted.
All right, there we go. A failure to rescue. I mean, if you feel like if you have like a patient coming in and you're not doing everything you can to help that patient, you're kind of just doing like the minimum for them and you're not doing like everything that you possibly can for that patient.
Okay. And so to carry that out a little bit, maybe they're being admitted with chronic or severe hypertension, and the doctor ordered a medication to start, and you did not go back and check on the effect of the medication, and your patient got worse and worse and worse. It wasn't working. So you failed to rescue that patient. Yeah. So it's usually based on a trend in health. So as nurses, we are trained and we learn what we see, what we read about our patients should give us clues, should help us to analyze. Is there something going on with this patient that I'm noticing? Some changes. And if you don't act on those changes, that's failing to rescue your patient. Okay? All right. So standard of care is the level of practice that a reasonably prudent nurse would provide in similar circumstances. In other words, all nurses, if they're prudent, in other words, if they're concerned about the well-being or the outcome of good health of their patients, they're going to practice in this manner. They're going to follow the standards. So to determine if she's been negligent, her care is compared to the other nurse. And if the nurse that's negligent did not follow the standards or did not practice according to the standards and harm occurred, that is a negligent nurse. Okay? Does everybody pretty much makes sense, right? Just do what you should do, right? All right. Let's switch gears a little bit. What about some culture questions? What about an RN ask her client, how will your family members participate in your pregnancy, in labor, and in parenting? What kind of a nurse is that? What is she exhibiting? A, B, C, D.
I'll say D.
D.
D. That's what I would say. I don't know if that's.
What is cultural relativism?
Is it trying to relate with the culture?
Okay. It's relative. In other words, the information of your patient's culture is relative.
Okay.
In other words, you need to know that information in order to provide her the best care.
Yeah.
Right? So if you have a patient that wants to wear a certain kind of gown during labor or wants to do a certain sort of thing, a certain position, as long as she's going to be safe, then we need to allow that, right? Because we're respecting her culture, what her own traditions are. So you, as nurses, you have to ask questions. You have to ask questions of your patients. What is ethnocentrism?
Ethnocentrism.
Isn't that like being biased towards like your own like culture? Like kind of thinking that like your culture is almost like superior compared to like the person that like the other person's culture.
Yep, exactly. It's the opposite of being culturally sensitive. It's the opposite. Ethno means me, myself, my values, my beliefs, my traditions. And then central, meaning my value is central to everything I do, and you should do it too. Okay? Yes, it's the opposite. You don't want to be that way. Does anybody know the difference between, between the acculturation and assimilation? What does anybody know the difference between the two? So let me give you an example. If I were to move to Japan and live there for 6 months, and I wanted to practice some of the Japanese cultures, and yet I kind of retain some of my own personal beliefs and cultures and values, but I picked up some Japanese ones. Is that assimilation or acculturation?
Assimilation.
Acculturation?
Culture.
Yeah. Assimilation would be, I want to be Japanese. I'm going to speak the language. I'm only going to eat Japanese food. I'm going to only practice their religion, and on it goes. Okay. That's the difference between the two. Now you'll notice if you read and get on social media and stuff, they use the words interchangeably. Okay. And I don't think you're not going to be required to really understand the difference between the two, but I wanted to just make sure for now you understood it. Okay. We've talked a little bit about disparity, gaps in the way care is provided, or the way resources are distributed. There's a gap, there's a disparity. And those people who are lost between the gaps, in other words, they're in a population of people that we consider vulnerable. In other words, they might have health problems because of the gaps in care. Can you think of what populations that would be considered vulnerable?
Low income families.
Okay. Low income.
Minorities.
I'm sorry. What?
Minorities.
Okay, minorities. Minority meaning what, 12% of the population are African Americans, 15% are Hispanic. Those are the minority groups.
Mm-hmm.
Okay, so minorities. Okay. What else?
Mental disability.
Okay. I had a patient that had, the patient herself presents pregnant, and she has fetal alcohol syndrome, intellectually challenged, emotionally immature, extremely. And so she would be in that group. She's vulnerable to have poor outcome to her pregnancy if she doesn't get prenatal care. Okay. Who else?
What about families in like rural areas who don't have
Exactly.
access?
Yep. There's places in many rural communities that don't have OB providers. Yeah. Or at least high risk providers. Okay, good. Can you think of any group of other groups of women that might be vulnerable during pregnancy?
Those who don't have health insurance.
Yeah.
Also younger women.
What about like abuse,
Intimate partner violence.
Yeah.
Yeah.
I didn't spell adolescence right. Adolescence.
Yeah.
Here we go. So adolescents, yeah, they're and we talk about that next week. Just actually this week too, just the high risk that they are, because they're still growing. So this is a woman under 18 and under, and she's still growing. And these women often have small babies. So, and they don't have really good nutrition. So who else?
Women that are homeless.
Had one of those. She did great. We had to, make sure, as nurses living in a certain community, you need to know your community resources. So we had to direct her get her in the right direction. We got her insurance and some food, help with food. Got her in a shelter. So, yeah.
I have a question. Would obviously, even if they're homeless, they would still be able to take home their baby, correct? Or is that, I don't know.
Yeah, well, hopefully we can help resolve that situation. And yeah, it's case by case. Yeah. The homeless pregnant patient I had, yes, she wasn't homeless by the time she got the end of her pregnancy. A lot of counties in every state can provide public assistance as far as pregnancy insurance, so that they can get care during their pregnancy for them and their baby. It ends after they deliver their baby, but then they can get other kinds of care for their newborn. Okay, we've hit a lot of them. So let's go on. So some barriers to preconception health. Now, your first discussion post is about preconception counseling. One barrier to this is that half of pregnancies, only half are planned. So it's kind of hard to do preconception counseling when you don't really plan a pregnancy and you get pregnant. So transportation, worried about childcare, their job, income, education. They don't know that they really should be going to every prenatal appointment. Education level, not understanding things. Access, no provider. And of course, underage, adolescents. They haven't told mom and dad they're pregnant yet. So they're not going to go early. They're going to go as late as they can, right? And then, of course, abuse situations, human trafficking. They're not going to get pregnancy counseling, and they're not going to probably attend very many prenatal visits. So when we do interviews with our patients that come into a prenatal clinic, we have to do an extensive interview. We want to know all about them, because we want to identify risk to her and her baby that could cause problems. We want to be educating these patients and planning other interventions to mitigate any of those risks. So we're looking at not only her physiological health, but we're looking at social history, married, support, alcohol, intimate partner violence. We're looking at her family situation. We're looking at her resources. And then we have to do an exam. So we as nurses are educating as we're interviewing, we're educating when we're assessing, we're educating when they come in for every prenatal visit during the antepartum. Exposures to chemicals and substances. This is just, I got these today. It's just updated statistic on domestic violence, intimate partner violence, and you can read through these. And it comes from the SouthDenverTherapy.com group, and it was excellent. They have a lot of good stuff in there, so you can read through that when you get a chance. I will post these slides in this week's announcement. Welcome to OB Guide to Week 1. I'll put these slides in there, okay? So what we're going to be talking about Sunday night is we're going to be reviewing physiology and anatomy. So be familiar with the anatomy of the female reproductive system. And then the blood supply to the uterus, of course, comes from the aorta. And we're going to be talking about that. And then vaccines. Now, you don't have to know this for the first quiz or even the first exam, but you're going to have to know it by later exams, probably exam 3 in the HESI. We do not give live vaccines during pregnancy because they can harm the fetus. And those live vaccines are the rubella, the varicella, and the human papillomavirus. We can give Tdap, COVID, and RSV during pregnancy, and it's recommended in the 3rd trimester. The reason it's recommended in the 3rd trimester because it protects mom, because during pregnancy her immune system is repressed, so we want to give it a boost. And by the 3rd trimester, baby's already formed and developed and growing, and those vaccines are going to all not harm the fetus. In fact, when we give it to the mom, the baby benefits because the baby takes those IgGs with them when they're delivered, like COVID, RSV, and the influenza. So a newborn up to 6 months is going to be protected from RSV simply because mom had the vaccine late in pregnancy. So when we give RSV vaccine during late pregnancy, it reduces the incidence of SIDS in newborns less than 6 months old. So this is one of those research information that we know for sure that the new administration, the new Secretary of Health has said, no, don't do it. But what we're going to see if people listen to that is we're going to see an upsurge in SIDS, see an upsurge in measles, upsurge in all of the hepatitis B and all of those things. So we have to go back and see what does the research tell us. And then you'll learn about RhoGAM. RhoGAM is an immunoglobulin that we give to mom if she doesn't have Rh antigen on her red blood cells. All right. So this week we've already run over time. Remember what your assignments are and get those done, and then prepare for quiz 2 next week. Okay. Try to come Sunday night. If you can't, I understand. I'll post a recording. Okay. You can sign off now.
Thank you.
You're welcome, everyone.
Bye. Thank you.
Bye.
You're
Bye,
welcome.
thank you.
Bye.
Bye, thank you.